All right, today we're tackling a really interesting one: carpal tunnel versus cervical nerve compression. It's a medical mystery that so many people deal with. You get that numbness in your fingers and you think you know what it is, but the real problem? Well, it might be hiding somewhere you would never expect. So, let's dive in.
Okay, so you've got numb fingers. You know that feeling, right? That pins and needles sensation? And your brain, it just immediately goes to one place. Oh, it's gotta be carpal tunnel. I mean, it's the classic diagnosis. But here's the thing. What if the real culprit is hiding somewhere totally different and it has nothing to do with your wrist?
And this right here, this is the heart of the whole mystery. You gotta remember, the cause isn't always where you feel the symptom. Think about your nerves, like these super long highways that run from your spine all the way down to your fingertips. And just like a real highway, a problem, a traffic jam, can happen anywhere along that route. The spot where you feel the numbness, that's just the end of the road, the destination. It's not always where the accident happened.
All right, let's start our little investigation with suspect number one, the usual culprit. I mean, when you say numb fingers, where does everyone's mind go? Straight to the wrist, right? A problem right there.
And that's carpal tunnel syndrome. It's a condition where a nerve gets compressed in this little narrow passageway on the palm side of your wrist. They call it the carpal tunnel. Just imagine a really important cable running through a super tight space. If that space gets crowded, maybe from swelling or just from doing the same motion over and over, that nerve gets pinched, squeezed. And this tunnel in your wrist, it's a really busy pathway for nerves and tendons. I mean, it is a crowded place. It's not just a one nerve we're talking about. There are actually 9 different tendons all trying to get through that same tiny space. So with that much traffic, you can see how even a little bit of swelling could cause a major pinch, right? And when that nerve gets squeezed, what happens? Well, you get all those classic symptoms: the numbness, the tingling, sometimes even weakness that pops up in your hand and fingers. It's a pretty straightforward cause and effect situation, all happening right there in the wrist.
Okay, but now here's the plot twist. What if the problem has nothing to do with your wrist? It's time to bring in our second suspect, the hidden source: a problem in the neck. Seriously, this is the question you have to ask yourself, especially if you've been trying treatments for your wrist and nothing is working. It probably means you're looking in the completely wrong spot.
And that brings us to cervical nerve compression. Yeah, it sounds a little complicated, but the idea is actually super simple. It's a condition where a nerve that starts way up in your neck, in your cervical spine, gets pinched or irritated right at the root. Remember how we said nerves are like long electrical wires? Well, these wires run from your spine all the way to your fingertips. So a problem way back at the start, right where the nerve comes out of your neck, can send all sorts of messed up signals, numbness, tingling, all the way down the line to your hand. Okay, think of it like a kink in a garden hose. This is the perfect way to picture it. If you're holding the nozzle and only a trickle of water is coming out, you don't start fiddling with the nozzle, right? No. You look down the hose to see where the kink is, where the pressure is blocked. The pressure is in the neck, but you feel the effect at the very end of the line, in your hand. All right, time for the lineup. Let's put our 2 suspects, the wrist and the neck, side by side so we can really pinpoint that pressure point. We've got a problem in the wrist versus a problem in the neck. They can both cause those numb fingers, but they are totally different issues at their core. So when you look at them side by side, it really just boils down to one thing: location, location, location. For carpal tunnel syndrome, the problem is in the wrist. The nerve is getting squeezed right there in the carpal tunnel. But for cervical nerve compression, the problem is way up in the neck. The nerve is getting pinched at the spinal root. See? 2 completely different problems, but they create that same confusing symptom way down in your hand.
So, what's the verdict? How do you solve this mystery for yourself? Well, this is why getting an accurate diagnosis is so important. You just can't fix the problem if you're trying to fix the wrong part.
I mean, if you remember one thing from all of this, let it be this: numb fingers don't always mean a wrist problem. That feeling is just a clue. It's a signal, but it doesn't automatically point to the source. Yeah, the crucial point is that the symptom is the signal, but is not always the source. It's like your body is shooting up a flare. That flare, the numbness, tells you, hey, something is wrong, but it doesn't tell you where the fire is. The real work is following that signal back to find out where it's coming from. So, what does this all mean for you? Well, first, you've got to pay attention to all your symptoms. Do you also feel pain in your neck? Does it get worse when you turn your head? Don't just assume the most common cause is your cause. Because look, the right treatment absolutely depends on the right diagnosis.
Trying to fix your wrist when the issue is in your neck is just not going to work. Your best bet is always to consult a professional who can help you find the true source.
And that leaves us with one final question to think about. What other signals might your body be sending? If something as simple as numb fingers can point to a totally different part of your body, what else might we be misinterpreting? It's just a really powerful reminder to listen closely to your body and always try to trace things back to the source.